we look at the disc, and I love talking about the disc because I think too often the disc gets a bum rap. We often talk about a slipped disc, a herniated disc, my damn disc. Whatever the disc is almost irreplaceable. For years and years and years, scientists have been trying to replace the function of the disc. They're getting closer, but nowhere close to what we have in our bodies. The disc has a unique property of being able to displace movement in all directions. If we take a look and had the imagination of a ball between our hands or between the two bones, the vertebral disc allows us to go into flexion and extension from above, flexion and extension from below. Flexions laterally right and left from above, flexion right and left laterally from below. We can do rotation right and left from above, rotation right and left from below, anterior glide above, back and forth, anterior posterior glide from below, lateral translation right and left from above, lateral translation right and left from below, circumduction right and left from above, and circumduction right and left from below. That is more degrees of freedom than any other joint in our body. Now the beauty of this is we have 22 of them in our spine. So we have this incredible wealth and reservoir of movement in our spine that we, for some reason, do not use. The average person will move from 2 or 3 segments in their spine, and often only in 1 or 2 planes of movement. So you can imagine that according to Wolff's law, these tissues are not being stimulated, they're not being fed, they're not being cleaned. The way cartilage tissue, or these connective tissues and disc tissue, gets their nutrition is through movement. The way they get strong is through movement. The problem we have as a society is that for some reason we choose to move from 1 or 2 segments, and we go out and we do activities that put excessive force through tissues that are not prepared for those forces. In Pilates, our goal is to prepare those tissues for those forces in all directions of movement with graded activity. We start with simple exercises of movement into flexion, extension, side bending, rotation, and combine movements with minimal force. And that gradual progression of our exercise program will increase the stimulus to these tissues and not only provide nutrition to the disc, but also provide the stimulus necessary to make the fibers of the annulus strong to allow us to have safe movement in all planes. The other important thing here is that because there is no direct feed of vascular or neurological into the disc itself, deep in the disc, that it gets its nutrition osmotically and through pressure. So the way that we hydrate our disc is by making sure we're hydrated with drinking water and through movement. Those 2 things alone will significantly improve our health. We also know that there's some adverse things that we do, like smoking has been proven to dehydrate disc. Alcohol has been proven to dehydrate disc, and so has caffeine. And again, if you just think of simple properties of nutrition, if you're going to drink a beer or you're going to drink a glass of wine, you should drink an additional glass of water to make sure that you don't lose your hydration because they're natural dehydrators. And whatever tissue in our body, in our organs, our brain, our bones, our muscles, require the appropriate amount of water to function in their optimal state. The disc is no exception. We have discovered time and time again of patients who have had back problems that just start hydrating themselves appropriately, even if they have bad habits of smoking. Hydrating appropriately with those habits can decrease the pain significantly. Getting rid of the habits is even better. But if you still got to do the habit, make sure that you're staying hydrated. We're going to move now into some of the biomechanics and go back and visit this idea of the hydraulic amplifier, and just to accentuate a little bit more as it pertains to axial elongation and how the organization of these muscles and these body parts, the structure, the bones themselves, can significantly improve our axial length. So remember we said that the hydraulic amplifier was made up of the diaphragm from above, the pelvic floor from below, the abdominal muscles around the front and the back muscles in the back, and even the transverse that connects both. The pelvic floor and these muscles working together can control the intra-abdominal pressure, or the IAP. Now, when we think of drawing structure closer towards the central axis, we're going to increase the intra-abdominal pressure as well. We also can push out by closing our throat and do what's called a Valsalva technique, which is the most intense intra-abdominal pressure. So if you were lifting weights and doing powerlifting, you might choose to push out into your abdominal wall to create the greatest intra-abdominal pressure. If you were moving and dancing and swinging a golf club, you might choose to draw things in closer to central axis to give yourself more axial length and more freedom of movement. Sometimes we get confused with this, talking about core control, thinking that drawing the abdominal wall in is going to give us more stiffness or control. That's really not true. The greatest stiffness is bearing down and compressing that area, but also that has its side effects and negative factors as well, right? So you've heard of people that have had heart attacks by just simply having a constipation in their bowel movement. That valsalva creates so much internal pressure that their heart couldn't handle it, and they either had a stroke or a heart attack because intra-abdominal pressure was too great. In Pilates, we want to focus a little bit more on drawing in and bringing the structure closer to the central axis because we're more interested in functional movement. And if we can get you to move from 5 or 6 more segments in your spine and hydrate those discs and get that length and that relationship between the rib cage and pelvis, we're so much further along in longevity of health of your spine and the ability to perform the activities you want for the rest of your life. If you choose, or by job definition, you're doing a lot of lifting, then you might have to look and train and condition yourself to be able to use a little bit more of like the valsalva or pushing out in the abdominal wall with controlled breathing to increase that intra-abdominal pressure to protect your spine with very heavy loads.